Causes of cor pulmonale. So firstly, we will see the diseases of the pulmonary parenchyma. So the disease of the pulmonary parenchyma, it contributes to the cor pulmonale. So under this, there can be the COPD. There is a COPD, that's chronic obstructive pulmonary disease, as well as the diffuse pulmonary interstitial. This is the fibrosis. Next, what we have is the pneumoconiosis, as well as a cystic fibrosis. Next, there is also the bronchiectasis. Next, looking at the chronic hypoxia conditions, so also known as the disorders of the chronic, that's the alveolar hypoxia. So here it can include the, due to obesity, there can be the hypoventilation syndrome. Next, there can also be the central hypoventilation syndrome, then the neuromuscular respiratory failure. There can also be the chest wall disorders such as the kyphoscoliosis, as well as the chronic exposure. This is to the high altitude. Next, what we see is the diseases of the pulmonary vasculature. So disease of the pulmonary vasculature. So here there is the PAH. It is nothing but the pulmonary arterial hypertension. So here it can be various, that is, it may be idiopathic, can be hereditary, can be drug or toxin induced. Next, it can also be the veno-occlusive disease. Next, the other points it can also include in the pulmonary vasculature, that is a chronic thromboembolic pulmonary hypertension. Next, it also involves the pulmonary tumor thrombotic microangiopathy. So what we saw was the chronic thromboembolic pulmonary hypertension as well as the pulmonary tumor thrombotic microangiopathy.